Hey, this is Laura Reagan with Therapy Chat Podcast and Trauma Therapist Network. I'm an integrative trauma therapist in Maryland, USA, and I consult with therapists around the world. And I wanted to talk for a moment about 4 things that all trauma therapists and people who are seeking trauma therapy need to know about. And I'll go into this in more detail later, but this is kind of what I'm going to be talking about this month. This is just a starting point. Obviously, a video on social media is not comprehensive, but I wanted to put these thoughts out there because I think they're things that people don't realize, whether we are therapists or survivors seeking trauma therapy or just survivors of trauma who are seeking therapy and not aware that they're trauma survivors. Here are 4 things that I think are important to know. And you can go to traumatherapistnetwork.com to learn more. First thing is that what defines trauma is not only single incident experiences like a natural disaster, a fire, a flood, a car accident. Those are experiences that can have long-lasting traumatic effects, and they're very important, but that's not the only thing that we're talking about when we're talking about trauma. Another really important thing is that people who are seeking therapy often do not recognize trauma in their histories, but it's often there. And if therapists know how to accurately assess and diagnose trauma symptoms, then you can help your clients more effectively using trauma therapy methods rather than traditional therapy methods that are not effective for trauma. So on that point, the third thing I want people to understand is that when we think of therapy, we often think about top-down medical model. I'm on a couch talking and the expert doctor is telling me what's wrong with me and how to fix it. And then I fix it, or they give me a medication and it goes away and I feel better. That's not what trauma therapy is, and that is not the way to heal trauma. However, talk therapy, traditional therapy methods, and I include top-down approaches like CBT, can be helpful in teaching you to understand your thoughts, taking a look at your behaviors and the patterns in your behaviors. But if you're not using any bottom-up methods in the work, the results will not resolve the trauma. They may help the symptoms get better in the moment, which is great. But healing to me means resolving the trauma. The underlying problem heals. Not that it takes away the experience that happened, but the traumatic effects heal. That is an expectation that you can have when you go into trauma therapy. But you need to understand what you're signing up for and what type of therapy you're about to get when you go to trauma therapy, because trauma therapy is not a one-size-fits-all. There are a lot of different ways to approach trauma therapy. And the last point, which is a really big one too, is that there's a difference between working with a practitioner who's trauma-informed and working with a trauma therapist. There's trauma treatment and then there's trauma-informed treatment, and they're not the same. All types of healing methods and modalities should be trauma-informed, because so many people are walking around carrying trauma that they may not even know about. And trauma-informed healing practices will ensure safety within the paradigm that the treatment is happening. But trauma therapy is intentionally designed for resolving trauma. You want to know more about this? Go to traumatherapistnetwork.com and follow me here, because I will be talking about this over the next few weeks, months, years. Thanks.